Good afternoon. It is Tuesday, May 5th, 2020. I'm Keith Tebow. Thank you for joining me this afternoon as we provide continuing coverage and some interviews of people and interesting people and ideas that we're all sharing during this COVID-19 pandemic. You know, we talk a lot about the pandemic. We talk a lot about numbers. The numbers are never really that good. Fall River currently has over 600 confirmed cases of COVID-19 and 8 fatalities. But we thought today we'd bring you some news. Out of those people that have been confirmed cases, most people actually get sick and then they recover. We'll spend some time today speaking to one of those COVID-19 survivors. I'm pleased to be joined this afternoon by Barbara Beckmann. She is a Tiverton resident who is a survivor of COVID-19. Barbara, welcome. How are you?
Hi, thanks. I'm great. Thank you very much, Keith.
So I guess the first question is, how are you feeling?
I am feeling really, really good. I mean, it took me a long time to feel really, really good, but I feel like I'm back to my former self. I have energy. I'm working full time from home. I enjoy things. I can taste and smell things again. And yeah. I am grateful every day that I made it through this and I'm feeling as well as I do.
Well, I'm glad you have as well. Let's get right into it. We have heard some stories in the media about how people contracted the disease, the symptoms they had, how they felt. So let's go back. From what I understand, you actually felt symptoms of the disease pretty much mid to late March. Is that correct? Around the 20th or so of March? Yeah. And what were those symptoms like at the beginning?
Well, it was a headache, fatigue, and body ache, and cough. That's how it started with. And then the no smell started and the fever, and that was basically it. And the moment I got it, I called my doctor.
And what did your doctor tell you? I mean, at this point, cases started happening in early March. Was there still a little bit of uncertainty on your doctor's part about whether this was actually COVID-19 or maybe even the flu, the general flu?
No, well, I was tested for the flu first. So my doctor responded very, very quickly. I got the symptoms on Sunday, the March 22nd, actually. Called my doctor Monday morning and she got me immediately on the list to be tested at Primary Care. And they had the setup behind that, I think Pub 99, and it was just worked wonderfully. I drove in, I had my list. I got tested first for the flu. Had to wait an hour, got the results, and it was negative. And then they took the COVID sample. And then I could go home and had to wait. I got the results Thursday morning. That was a long wait. But by then I was pretty certain it had to be COVID. I was just not feeling well.
Yeah, so you found out about the flu first, the general flu, and it was negative. So at that point, you probably thought, well, I'm really sick with something here. It could be, COVID-19, right?
Yes.
So you talked about Primary Care. They're one of a number of testing locations in Fall River. Yeah. The 2 hospitals are as well. You had a great experience with them?
Yeah, they were great. I mean, it was a little bit unsettling is the wrong word, but I mean, everybody was in the hazmat suits and heavy gear, and people were lined up in their cars. It was a little bit strange, unusual for what we normally do, but people were really, really nice and gentle and explained everything. And I felt I was in very good hands. So it was not anxiety provoking or anything. The test itself is not great, but doable. I mean, it's just, it's fine. It's over in a second.
Yeah. So talk a little bit about, you were diagnosed a few days after, March, 26th or so, 25th, 26th.
Yeah, 26th.
So then you officially became into quarantine. What kind of ailments did you feel with it? You talked about some of them, about having a lack of a sense of smell and taste, but what were the symptoms really like when you got into the sickness of all this? And I guess, can you compare it to any other ailments you've had?
Well, the main symptoms were really the cough, the fever, and the fatigue. The fatigue is just unbelievable. I never had anything like that. And it takes a long, long time to come back. The cough was not that nerve-wracking. I had that fairly mild, but it took a long time to really go completely away. It was clearly not, oh, the body aches were pretty severe too, but they were only a couple of days, and I responded well to just regular pain medication. So that helped. But then I couldn't do anything. I was just so fatigued. I was laying in bed, no appetite, and just waiting for the days go by. So that was the difference about this before. And you were nervous because you didn't know what to expect. And every day you thought, okay, I made it through another day. I'm good. And I was really lucky. I was just laying low and waiting it out. I didn't have major fever. It didn't settle on my lungs. I live in a house with my husband. I could quarantine. I could open the windows. I had fresh air, but it's not like the flu. It was not like the flu. And looking back, I think the hardest is for me really was the fatigue.
Yeah, that makes a lot of sense. And we're hearing this from a lot of people who've gone through this, that, it's that fatigue. It just overwhelms you.
Yeah.
And you just mentioned that is the case. Now you talk about how you're home with your husband.
Mm-hmm.
You do have children, but they're grown, so they're out of the house. So it was just the two of you. And unfortunately, your husband also contracted COVID as well. Did he face similar symptoms as you did?
Yeah, he was pretty much just like myself. He just started 3 days after I did. At the beginning, he was pretty certain he would not get it because he thought he just wouldn't. But 3 days later, he developed the same symptoms and had the same path, took the same path that I took. He was not tested because it was pretty clear that it was the same that I had, and tests were at that point not that easily accessible. But we quarantined from each other for about 10 days, which we could. We have 2 bathrooms, we have 2 bedrooms. It was easy to do. And luckily, our children and friends delivered food because we had no energy to really cook or do anything. We had enough in the house, but we couldn't really go for anything fresh. And I craved oranges mostly. That's what I lived on. So we had support from others, and that's why we could easily do it and just rest and make sure the body does what the body had to do.
Yeah. Now, do you have any idea on how you may have contracted it, where you got it from? Do you have any idea at all?
No idea. No idea. I didn't know anybody even that had it. So I really have no idea.
Yeah. And when you were diagnosed, obviously that information is given to state officials. You actually live in Tiverton, so that was probably given to the officials in Rhode Island in terms of, marking it and counting it as part of one of the confirmed cases. Did you hear it all from the state, the Department of Health, in terms of getting some information on maybe who you had been in contact with before you got sick?
Well, I got a phone call from the Department of Health from Rhode Island, and they were very, very nice. They sent me a list to track my symptoms and all that stuff on through email, so I could do that. But they gave me a phone number to call if I needed help. They did no tracking, which surprised me. But it was still fairly early on, right? We're talking March 26th. They might have also been a little overwhelmed. I don't know. But they said since I had it over the weekend, I was not going to work following, developing symptoms. At that point, everything was shutting down anyway. They said I don't need to give names or even try to figure out who I was with. They also didn't call back at any time, which surprised me. But I had a number I could reach out if anything would have gotten worse. The same with my doctor, who was available all the time.
Now, in terms of, you received the diagnosis on the 25th, 26th of March. So right away you quarantined. Unfortunately, your husband came up and also got ill from the sickness. How long were you away before you felt like you could finally get back into, right now you're back at work. So how long did that whole process take? 2-3 weeks at least, right?
Yeah, we self-quarantined 3 weeks. We had, by that time, we were about 10 days without symptoms. But even then, we're still working mostly from home. And when we go out, we're very, very careful. I mean, we wear masks and we do all the precautionary things that everybody's supposed to be doing. It feels odd. I think I'm probably one of the safer people one can be around with right now, because I'm through it with it. I had it. I'm definitely not spreading it anymore, but you're very aware that you're one of the people that carried it.
I need to ask, and this is going to be a personal question. You have, children who are grown and out of the homes. Do you mind if I ask your age? Because,
No.
a lot of people are saying that in terms of, the susceptibility of getting really sick
Yeah.
and being dangerous, it's 60 and over. Are you in that realm,
Yes,
you and your husband?
Thank you for asking so carefully. Yes, I'm 62. My husband is 67. So we're right. I'm right at the beginning of the range. He's already a little bit more into it. But we made it through fine.
Do any of you have any other, the pre-existing conditions that may have been a more of a negative impact, or are you both relatively healthy otherwise?
We are pretty healthy. I have mild high blood pressure, and I'm a little bit on blood pressure medication. My husband is not taking any medications.
So that's a good thing. So you've both been relatively healthy up until this point.
Yes.
How difficult was it? And you mentioned this a little bit, just coping with it. I'm sure there were some evenings where you may have been restless, even though you were fatigued, you may have still been restless and not very comfortable to sleep. How difficult was it coping? And did you ever feel at all that, is this ever going to end?
Well, that will it ever going to end? Even the recovery period is so very long that you wonder, how long will it take to be over? I'm just really finally where I feel I'm myself again. And we're talking 6 weeks, over 6 weeks. But during the first week specifically, but then also the second week, we were just, well, you're restless. I mean, you doze, you watch a lot of TV, you read a little bit, but only that couldn't really do that much either. And you wonder what will happen next. You constantly listen into your body. You don't want to overexert yourself, because everybody says be careful, because that could end up in a hospitalization. So the anxiety was very high. My husband is more laid back. He was not as nervous. But so that was the main thing. But because you're so tired, I mean, the days were not long, but they were odd.
Yeah, that's a good way to put it. They were odd. I'm sure it's been odd for a lot of people across the country. Now, in our pre-interview, you said you have not been retested. But you're also maybe looking at helping other people out. So are you interested in maybe doing some antibody testing if possible to help other people?
Yeah. Both I and my husband would love to be tested for antibodies, or give plasma or whatever that would help to figure out how to get a vaccine and what's really going on. Absolutely. I mean, I do hope, having been through this, I would like to know that I have antibodies, and I would love to be immune to this. Having been through this ordeal, it would be great to have a positive outcome. And that means we could be helpful for others if they're sick or don't want to get sick, that we could go and get food or do other things, because we might not be perceptible. But first, we need to know that that's really true.
Yeah. Finally, let me just ask you, for those people who, may feel they have some symptoms, or may want to get a little more insight in terms of what to expect. Is it really an easy way to tell people what to expect if they do get sick, or is it just something that, obviously it's different from different people? There have been a number of people who've had symptoms that were milder than yours, some that were more severe than yours. So I guess, how do you tell people how to cope with this?
I think the most important part is really to call your doctor and go by their advice, what to do. Be gentle with anything that affects your lungs, because you don't want to overexert yourself. You don't want to, be next to a campfire, stuff like that. And then just and it's hard, right? Not to push yourself. The moment you get more energy, you think, oh, let me do this. This has to be done. You really need to give it time. Give it all the time it needs. Give your body the time so you do not end up in the hospital. And otherwise, I think we don't know enough about it. And it is so everybody responds differently. We have been lucky. It was not our doing, I think. I think we were just really lucky. But a lot of people are. And I think a lot of people don't even know they were lucky because they didn't have symptoms.
Yeah. Well, Barbara, you look great. I hope you're feeling well. I do want to thank you for joining us and sharing your story. I know it's not always easy to share personal stories, but I think it's good to get this out there to let people know that, it may be a tough road, but there is an end for
Oh,
a
yes.
wide majority of people. And I want to thank you for joining us, and continued good health as you move
Thank you
forward.
very
Thank
much. Thanks for inviting me. I think it's important to tell people this can be dealt with. It's okay.
you. All right,
Thank
Barbara.
you.
Thank you. Have a great day.
You too. Bye-bye.
Again, I want to thank Barbara Beckmann for joining us today. She's very courageous in sharing her story, and I appreciate her doing so on our air. And I want to thank you for joining us, and I hope you'll have a great rest of your Tuesday.